The next series of movements balance on one leg and give activation of the different sides of the hip joint complex. At the same time, the hips control the spine. So as you activate each part of the hip, the corresponding part of the spine also becomes active, and the opposite side of hip and spine can relax. Tightening the front of the knee relaxes the back of the knee. Pushing the hips forward firms the front of the spine. The sides can be relaxed because I'm breathing diaphragmatically. Turning the left thigh out keeps stability in the hip, and I turn the shoulders in to stretch the wrists. Then, taking the left hip to turn inwards, I come to a side bending movement. Now it's the left side of my spine that's active. The right side is relaxed. Again, breathing into my diaphragm, breathing with my diaphragm into the abdomen helps maintain this. Bringing the hips level now, the hip is in flexion. The extensor muscles of the spine become active. The back of the spine is active. Here, turning the left thigh inwards releases and reciprocally relaxes the buttocks muscles and allows me to firm my hamstrings, which gives tremendous strength to the knee. Then I bend the left elbow and twist to the right side. This movement is emphasized by pressure from the right sitting bone and left armpit. That gives firmness to the spine. Breathing into the abdomen, diaphragmatic breath, gives a relaxation to the nervous system and helps activate the reproductive system, immune system, and digestive system. Now I twist to the opposite direction with hip flexion. Pushing the right shoulder to the left and left hip forward gives a spinal firmness. Breathing into the abdomen with the diaphragm gives a calmness, stimulates the parasympathetic nervous system. Here, hip flexion and spinal flexion together. Throughout the movements, the fingers and toes in the air are spread, and that helps pull the blood from the core center of my body to the fingers and toes. The toes on the floor are gently gripping, and that helps me balance and pushes the blood away from the floor against the flow of gravity. Turning the thighs out, the right thigh out and the shoulders in, stimulates the right side of the trunk especially, so the right side of my spine is firmer than the left. I turn the thigh inwards as I start to extend. My left hip and side flex the right side of my spine. So the right side of my spine is quite firm here, whereas the left side is very, very soft. That means then the right side of my spine sends signals of reciprocal relaxation to the left side of the spine. So if the lower back on the left side is in spasm or sore, then tightening the right side can release that. Turning my right thigh inwards and lowering the hips to be level allows my back muscles to become active in spinal extension. I don't have to tighten my front muscles at all. The abdomen can be relaxed, but as soon as I shift the weight to the front of the feet, the abdomen becomes firm. Yet that does not disallow me from breathing diaphragmatically, which keeps me calm. I bend the elbows and twist to the left side. Because it's a twist to the left, I prepare for it by pushing left sitting bone and right armpit forward and towards each other. This spinal twist will make my abdomen immediately firm. It's an active spinal twist, but it's not the sort of firmness that inhibits the flow of blood. So all these movements, in coordination with the diaphragmatic breathing, will allow the body to warm up very, very quickly, but it hardly feels like my heart is racing or my breath is racing. In essence then, these movements prepare you for everyday life where you can learn to do stressful things in a calm way. And often fitness is measured, not as many people think, by how fast you can make your heart beat, but actually a fit person is one who can do a lot and hardly have their heart beat at all.